Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaz. And we will finish a lot of points today. We will touch 500th point, finishing almost totally 4,000 points are there in preventive medicine. So at least 1/8 of our mission is over, right? So every day evening, 6 p.m. to 8 p.m. and at least 150 to 200 points revision every day. So totally 60,000 points from 19 subjects. That is what we are going to revise. And shortly we are going to launch the new version of Wongo app, where you have 50,000 MCQs, subject-wise, topic-wise classified, available as a artificial intelligence chatbot. And as you keep practicing, the chatbot will understand what are your areas of strength and weakness, and accordingly it will remind you what are the topics to be revised and what questions to be revised. Similarly, the chatbot also contains 60,000 high-yield facts, and you can always decide whether you know it or you don't know it, or you want to bookmark it. Accordingly, it will keep reminding you. So this is what we are going to do with the artificial intelligence machine learning chatbot, which will act like a virtual tutor accompanying your preparation. So with that preamble, let's make the great beginning, Doctor. Yes. So yesterday we are talking about the various features that define the association and causation. So what is meant by temporal association? Can the online students can punch whether the voice is loud and clear? Raghu, can you tell me voice is loud and clear? Voice loud and clear. You can close the door. Yeah. So temporal association means anda pehla hai ya murgi pehla hai? Is the cause first or effect first? Unless the cause precedes the effect, you can't say they are associated. Right? गंगा बहना शुरू हुआ और राधा को प्रेगनेंसी हुआ. राधा के प्रेगनेंसी और गंगा बहने को कुछ संबंध है क्या? कुछ भी नहीं है. Right? So that's the reason whether cause precedes the effect or not is very important, which is called temporal association. So to prove the causal association between risk factor and the disease, what is the most important feature? Temporal association must be proven. That, okay, cause existed. After exposure to the cause, the effect happened, the disease happened. You have to prove that. Temporal association, how can you establish that? We use the cohort study, especially concurrent cohort study, in order to prove the temporal association is what you have to emphatically remember. Now, how do you prove the strength of association? In a cohort study, we use relative risk. That is the disease among the exposed by disease among non-exposed to be studied. No, relative risk. Attributable risk means risk difference. So cohort study, we use relative risk. In case control study, we use odds ratio is what we need to remember. Now, what is meant by specificity of association? So typically, somebody is eating idli. Somebody is smoking, I mean the same guy. And the same guy is divorced. The same guy also has migraine. The same guy is a topper in NEETPG. Then the same guy got heart attack. So if the heart attack is because of smoking or idli or migraine or divorce or NEETPG, we don't know. Right? That's the reason specificity of association is required. But this is the weakest criteria to prove the causal association. Because there is a possibility that partly because of idli, partly because of smoking, he got the heart attack. Right? So that's the point, specificity of association. Next is consistency of association. It implies that even if you use different methods, you took mock test of one coaching center, second coaching center, right? And even you took Dr. Murali Bharadwaz test series also. In all test series, regularly you are scoring 80%. Then that is called consistency of association. Biological plausibility. That means if something happened, you should be in a position to explain it anatomical, physiological basis, which is called biological plausibility. So, Anandam Ayurvedic medicine. You put a little herbal in the ice, suddenly person oxygen saturation levels improved. Then where is the biological plausibility for that? Very difficult, right? Next, coherence of association. So, if you have relevant facts, those facts must be able to explain the association. That's called coherence of association with the known physiological facts, etc. So these are all the part of the causal association proof is what you need to remember. Of all, what is most important proof? Temporal association is most important. Specificity of association is the weakest proof is what you need to remember. Then dose-response relationship. So, if you increase the dose, it should increase the prevalence of the effect. For example, you are having, you said that if you give beta blocker, you will control heart rate. So when you increase the dose, if you are able to increase the incidence and prevalence of effect, then that is also a proof of causal association is what you need to remember. For example, 10 cigarettes is causing cancer 10% of times. 100 cigarettes every day is causing 100% cancer. Then that is a good dose-response relationship of association is what you need to remember. Similarly, if you want to call something as a risk factor, if you stop the exposure, if there is a reversibility and a reduction in the risk, then that is also a proof of biology of causal association is what I want to underscore to all of you. Shanti, Shanti, Shanti. Now, some important terminology which we should be good with. What is meant by infectivity? Number of infected people out of the number of exposed people will give you infectivity. Pathogenicity means what? Out of the number of infected people, number of people becoming diseased is called pathogenicity. Then what is virulence? Out of the number of diseased people, how many are developing a serious condition or death is virulence. Communicability, ability of a disease to spread from an infective to susceptible host is called communicability. That is what you need to remember. See, these are all basic facts. One time at least you should listen this Ramayana Mahabharata. But some points will be there which you need to buttify. I'll show you. That you need to mark last 40 days or 30 days, you should revise them. So that is how we should basically proceed. Zoonosis. Whenever an infection or infectious disease is transmitted from a vertebral animal to the man, you call zoonosis. Anthropozoonosis means, zoo means animals. Animals to man is called anthropozoonosis. Anthro means human. So what are the examples of animal to man? Rabies, plague, anthrax, hereditary disease, trichinosis. They're all the examples of what? Anthropozoonosis is what you need to remember. Zoanthroposis, that is reverse zoonosis. Man will cause animals to die by transmitting. So what are the examples of zoanthroposis? Human TB can go to the cow, can go to buffalo, can go to the cattle. That is called zoanthroposis is what you need to remember. Amphixinosis, both directions, human to animal, animal to humans. So what are the examples of amphixinosis? Once more, this is a batti marne wala point aa gaya. And on the Wongo app, if you tell to the chatbot, hey chatbot, remind me, I'm not very sure, I want to be reminded. If you tell, then chatbot keep reminding you this fact, right? So that is how it acts like a chotu, who will be your companion until you become topper. But when you become topper, no, you can't give laddu to the chotu. But you send me the laddu packet. Don't forget, right? So even if you don't pay fee also, no problem, but give me the good news when you crack the entrance. Schistosoma japonicum and Trypanosoma cruzi are the example of amphixinosis is what you need to remember. So what are direct zoonosis? Basically, they are transmitted from the infected to susceptible vertebral host by direct contact or with a fomite or so is it still 1 minute? Yeah. Okay. Am I audible? Yeah. So direct zoonosis. Is it audible? Okay. No, just now I got a ring. Did it have a break? Just check that. So direct zoonosis are from direct contact, fomite or vector. That's what you need to remember. So what are the examples of direct zoonosis? Rabies, brucellosis, trichinosis. They're all called direct zoonosis because susceptible person, directly they come by, from the infected to the susceptible host. They directly come by direct contact or fomite or a vector. It's called direct zoonosis. So rabies, brucellosis, trichinosis, they're all example of direct. Then comes cyclozoonosis. More than one vertebrate species is involved. Then that is called cyclozoonosis. So Taeniasis, Echinococcus, you try to tick mark this point in the notes given to you. So not only chatbot, you also get the printed notes of point to point, all 60,000 points that we are going to discuss from the 19 subjects You are going to get the notes when you join us, right? Very good to see 4 online classmates. So, Peniasis, Echinococcosis, that's the example of cyclozoonosis is what you need to remember. So, what are metazoonosis? They're basically transmitted biologically by invertebrate host. They are called metazoonosis. So, what is an example of a metazoonosis? So, invertebrate vectors like plague, fleas don't have a vertebra, schistosomiasis, arboviral infection, invertebrate vector is called metazoonosis, is what you need to remember. Saprozoonosis, it is a non-animal developmental site. I mean, the growing of the organism happens in soil, etc. It is not an animal. So soil, when it acts like a reservoir, then that is saprozoonosis. So mycosis, cutaneous larva migrans. Typically, cutaneous larva migrans happens through the contact to the infected organism in the soil is what you need to remember. Then what is meant by epizootic disorders? Whenever an epidemic of a disease in animal population, that is called epidemic in zoo, is epizootic, is what you need to remember. So what are the examples where epidemic happens in the animals? Anthrax, brucellosis, influenza, rabies, Rift Valley fever, Q fever, Japanese encephalitis, that can spread in the animal. Epidemic can happen, right? Then enzootic. Enzootic is endemic happening in the animals, is what you need to remember. So anthrax, rabies, brucellosis, bovine TB, endemic typhus, tick typhus, herds of animals. Sometimes they need to kill a large number of sheep or cows at a time because of the presence of an epidemic, epizootic spread of the disease is what you need to remember. Now, epornotic. Ornithology means birds. Whenever outbreak happens in bird population, it's called epornitic, is what you need to remember. Now, what is an endemic curve? So the number of cases for a period of time for an endemic disease, whenever you draw, that's called endemic curve. So endemic is at a given frequency, it continues to stay in the population. Suddenly, when number of cases increase, then it becomes epidemic. So endemic is not a straight line, because if you look at the endemic curve, sometimes cases will slightly increase, decrease, increase, decrease. Every day morning while having coffee, first thing I will search is how many cases in Telangana of the COVID cases. Today it is 30 cases, yesterday 15, another day 20, like that. It has almost become like an endemic. So endemic curve is not a straight line, because the number of cases for the endemic will not be fixed throughout the year, is what you need to remember. Now, if you look at endemic versus epidemic, an epidemic can reach the baseline, but endemic never reaches. That means some number of cases constantly remain in the community. That's the reason endemic curve never touches zero. That's what you need to remember. Now, what is incubation period? Between the invasion of the infectious agent, COVID virus came, touched your nose and entered your body, to the appearance of the first sign or symptom is called incubation period, is what you need to remember. So what is median incubation period? It is the time by which 50% of the cases occur. 50% of the cases occur is called median incubation period. Generation time means what? Typically, it is the time taken for a person from the time he received infection, right? We need to be a little careful with these definitions, doctor, because the examiner is very particular, right? So, generation time. So, generation time is from the receipt of infection to development of maximum infectivity. You sneeze, even you come into the class also, entire class is infected, means you are in the generation time point, maximum infectivity. Then comes, now generally generation time is roughly equal to incubation period. That is, when the person is symptomatic, definitely he is in the maximum infective point. So generation time generally is roughly equal to the incubation period is what you need to basically remember. Then comes the latent period. From the start of the disease to the detection of the disease, there is some time. Generally, it is not used in infectious conditions. It is used in non-infectious conditions, the concept of latent period. So, for example, you started smoking and the tongue developed epithelial metaplasia. By the time cancer appeared, so from the disease initiation to the time of you detecting the disease, you have done a test, took a biopsy, looked in microscope, found the cancer. So between the disease initiation to the disease detection, the time period is called latent period. So if you happen to do a screening test, you can be able to diagnose it much earlier. So by that, what is happening? Latent period is decreasing with the help of a screening test. That's what you need to basically understand. So what is serial interval? Between the primary case, that is the first case in the community, and the secondary case, the case which is developed because of exposure of a susceptible person to that primary case, is called secondary case. In a family of about 4 children, first child went to school and brought cold. Remaining 3 children who are susceptible also developed cold. The remaining 3 are called secondary. First case is called primary. So between the two is called serial interval, is what you need to remember. Period of communicability. That means the time period during which any infectious agent is transferred directly or indirectly from the infected person to another person, or infected animal to man, or infected man to animal, is called period of communicability, is what you need to remember. So what is the measure of communicability? How do you say this disease is more communicable? This virus is more communicable? It all depends on secondary attack rate. That is, if one infected person happened to come in contact with 100 risk susceptibles, how many of these susceptibles are becoming secondary cases is basically called secondary attack rate. So the more the number of people are becoming secondary cases, that means it is more communicable. So most important measure of communicability is secondary attack rate, is what you have to emphatically remember for the tomorrow's exam, doctor. Now, what are the factors that decide incubation period? Why incubation period is less, large, long, short for different organisms. Number one, it depends on the generation time of the pathogen, how the pathogen is able to multiply. The time taken before the person become communicable. Then little dose also is causing a how much of infective dose. If you put nose to nose and the whole sneeze came into your nose, then high infective dose means very quickly you develop symptoms. From distance he is sneezing means amount of exposure is less, means that will make the incubation period a little longer that way. Surely portal of entry, nose is faster. Sexually transmitted diseases are not as fast. Incubation period is lesser with the nasal transmission. Individual susceptibility, those who are elderly, those who are immunocompromised, in them the incubation period is shorter. So that's the point you need to appreciate. So why do we need to know about incubation period? There are 5 points you need to know. Number one, incubation period helps you to know the prognosis. Incubation period makes you to identify whether it's a point source epidemic or a propagated epidemic with secondary cases. You want to give vaccination, you should know about incubation period of the disease. How long you need to do surveillance for that particular organism, you should know incubation period. If you want to trace the source of infection and the contacts, you need to know about, you should have knowledge about incubation period. So please don't forget, they are very easy, but you need to discuss with your friends to absorb. Each of this is an MCQ option. Incubation period is useful for option A, source of infection and contacts tracing. Period of surveillance is not dependent on incubation period. Is it true or false? Examiner will ask you. So these 5 points you have to know about. Incubation period is what you need to basically remember. So what is attack rate? Number of new cases in a specified time interval divided by total population at risk. So what is denominator? Total population at risk during that interval, 1 year, 6 months, 1 month, whatever. Number of new cases into 100 will give you attack rate. So attack rate reflects the extent of epidemic. So if the new cases are happening less out of total population, that means attack rate became less, epidemic is over. And it relates to what? Attack rate, to the total number of cases which are happening. It is related to the total number of cases that are happening. Okay, that's very important. Now, what is the formula for secondary attack rate? This is a favorite question of the examiner. Number of exposed people who are developing the disease within the range of a incubation period, one incubation period, after the exposure of the primary case. So primary case is not included in numerator, not included in denominator. We are all talking about what? Secondary cases. So number of susceptibles are who? Susceptibles, 4 children are there, 1 got cold. Don't include him in the denominator. Remaining 3 are susceptibles. Out of the remaining 3, 2 developed cold. So they became what? Secondary cases. So include them in the numerator. So number of secondary cases developed within one incubation period divided by number of susceptibles. Don't include the primary neither in the numerator nor in the denominator while calculating the secondary attack rate is what you need to emphatically remember. So secondary attack rate is number of exposed people developing the disease within the range of one incubation period divided by total number of exposed or susceptible contacts into 100 will give you the secondary attack rate. So the denominator in the secondary attack rate are only susceptible people. Don't include the primary case. Very, very important. Primary case is always exclude both from the numerator or from the denominator while you are doing the secondary attack rate calculation. Abhi batti marne wala item. What is the secondary attack rate of few organisms, few conditions frequently asked in entrance? Pertussis 90%, mumps 86%, chickenpox 90%, measles more than 80%, smallpox is 30 to 45%. So one of our SPM professor used to say, if nothing comes to your mind, tell the answer as 90% when anybody asks secondary attack rate. If nothing comes to your mind when incubation period, simply say 7 days, finish. You are lucky to win, right? So who is a reservoir? What is the definition of a reservoir? Reservoir can be a human. Reservoir can be an animal. It can be an arthropod, it can be plant, it can be soil, it can be substance, or a combination where the infectious agent lives, infectious agent multiplies, infectious agent depends for its survival, and where it reproduces itself before it gets transmitted to susceptible host. That is called reservoir, is what you need to remember. Then who is a carrier? Carrier is an infected person or an animal, person or an animal already infected without clinical disease. That means he is not symptomatic nor any clinical disease, and serves as a source of infection for others is called carriers. So where do you see animal reservoir? Rabies, influenza, yellow fever, histoplasmosis, they're all what? Animal reservoirs. Soil is a reservoir where organism depends on the soil for its multiplication, survival, etc. Tetanus, anthrax, coccidomycosis, mycetoma, बट्टी मारने वाला आइटम है. वांगो AI chatbot को बोलो छोटू मुझे याद करो, right? That is the trick. Then one more thing, the Wango AI chatbot will be analyzing how many points you are pushing into I don't know, how many points you are pushing into I know, how many points you are pushing into bookmark. Accordingly, it will keep on giving you. Once you solve 20 points, it will calculate based on the entire population who is using the app. What is the chance of you becoming topper? Automatically, it will do computation. That's the beauty part of machine learning. So the future is going to come in such a way, if you are not sure whether your girlfriend's mood is good or not while going home from hospital, you can use the Wango chatbot. What's the chance that, like the weather report, that I will have a stormy weather in the home? You can ask the chatbot, right? Yeah. So now some common questions asked. What is the source? What is the reservoir for various infections? Hookworm, the source is the soil, and man is the reservoir. That's what you need to remember. Tetanus. Source is the soil, reservoir also is soil. Then comes typhoid. Typhoid, you know, Basu. What is Basu? Do you know Basu rule? No? Oh my God. Come on, Dr. Teja. Diagnosis of typhoid, Salmonella is done. First week, blood report, that is vital. Sorry, blood report. Second week, agglutination, which is vital. Third week, stool culture. Fourth week, urine culture. What is this rule called? Basu rule. Yo, where are you? Where are you? Actually, there are some points. If you don't know, means you are far away from getting seated. Right? Some points you know means brilliant. Very few people know. How do you know? Maybe you are born to become a topper. That's what the machine learning will be analyzing you. Right? Now, typhoid. Feces, urine, food, milk, water, from anywhere you can get the typhoid. And who is the reservoir? A case of typhoid or a carrier of typhoid is the place where it will be multiplying and ready to attack the next susceptible host. That's what you need to remember. Now, what is the primary case? The first case of a communicable disease which is introduced into the population, right? So there is a school in Bihar, Muzaffar Nagar. In Patna, there is a school. A child, Raju, transferred from Patna to Muzaffar Nagar. While coming, Raju brought a running nose to Muzaffar Nagar. All other children in the class 6 are not having cold in Muzaffar Nagar. So the Raju from Patna jo aa gaya hai Muzaffar Nagar ko. वो कौन है? Primary case बन गया. Secondary case, Raju met Ramu, Raju met Geeta, Raju met Karna. Out of them, Geeta only developed running nose in Muzaffar Nagar. Right? So, Geeta is then called secondary case. Secondary case is what you have to emphatically remember for the tomorrow's exam. Index case. Index case is different from primary case. Raju from Patna school came to Muzaffar Nagar with a running nose. But the teacher did not find him, discover that he is running nose. But Raju infected a guy, another guy who is Bimo. But Bimo teacher has seen that he is having a running nose first time. Then Bimo become a index case. Raju is a primary case. That's the difference. The first case that comes to the notice of the investigator is called index case. The first case introduced into the community is primary case. And among the susceptible, whoever has developed is a secondary case. That's what you need to remember. Now, some organisms, carriers are carriers during incubation period. No symptoms, they just received organism multiplying. That time they can infect others. That's called incubatory carriers. ये बट्टी मारने वाला item है. Measles, mumps, polio, pertussis, influenza, diphtheria, hepatitis B, incubatory carriers. Incubatory carriers. Then comes convalescent carriers. So, clinical recovery does not coincide with bacteriological recovery. That is convalescent carriers who become carriers during convalescence period, actually. Right? So, actually, these are not, there's a small correction in the notes. There are correction karo. A incubatory nahi hai, convalescent likhna. Point number 441. Typhoid, bacillary dysentery, amoebic dysentery, cholera, diphtheria, pertussis, they're all convalescent, right? Convalescent. Then comes healthy carriers. So healthy carriers are from subclinical cases. They don't have disease, overt disease, but they are capable of infecting others. They are called healthy carriers. Polio, cholera, meningococcal meningitis, diphtheria, salmonella. You don't know the other guy has polio or not. He has a subclinical polio, but he can infect you. So healthy carriers exist in poliomyelitis, cholera, meningococcal meningitis, diphtheria, and salmonellosis is what you need to remember. So incubatory carriers, convalescent carriers, healthy carriers, they're all temporary carriers. Whereas chronic carrier means for an indefinite period, he keep on releasing the organism and infecting community. So typhoid, hepatitis B, dysentery, meningococcal meningitis, malaria, gonorrhea, chronic carriers, right? So that's what you need to basically appreciate. Typhoid में होता है urinary carrier. Typhoid, cholera, amoebiasis में होता है intestinal carrier. Nasal carrier, you see it in diphtheria, staphylococcal food poisoning. What staphylococcal? Sorry. Staphylococcal food poisoning, you don't find nasal. Diphtheria, sorry. That was a mistake. Yeah. Nasal carriers, examples are diphtheria. Right? Nasopharyngeal carrier is meningococcus. Now comes, how do you investigate epidemic? So we all lived in pandemic recently, so this applies very well to you. You can align it very clearly. First to diagnosis को verify करना. भैया ये कोरोना है, सचमुच कोरोना है या simple common cold है. Verify the diagnosis. So you have to take a nasal swab and then send to lab, and it should be corona positive. First to verify the diagnosis, then confirm epidemic. That means regularly only about 10 cases of corona are there. Unless it has become 100 cases, you don't consider it an epidemic. So how much from the normal existence it has increased, you need to look for. Define the population at risk. Children are not risk. So don't worry. Right? Elderly are at risk. Those who are taking anti-ACE inhibitors are at risk. Then rapid search for all cases. Airport se nikalne wale ko sabko pakdo aur check karo. And ultimately do the data analysis is what you need to remember. So for all these various steps, doctor, verification of the diagnosis is the first step of investigation of epidemic. This is a favorite MCQ of examiner. What is the first step in the investigation of epidemic? What is your answer? Verification of the diagnosis is the first step in the investigation of epidemic is what you need to remember. So, when do you call endemic as an epidemic? So, there is certain X number of cases that happen that define endemic, right? Two standard errors from the endemic occurrence. That means two standard deviations. Number of cases increased. Then that is called epidemic threshold. It's not one standard error, three standard error, two standard error. That's what you need to remember. Now, until when will you search for new cases? So, search for new cases in epidemic happen every day until the area is declared free of epidemic. So when do you declare it as free of epidemic? Until 2 incubation periods passed from the last case. Then, until then, you will keep searching for new cases. So, for example, coronavirus is about 10 days, for example. 2 into 10 is 20 days. From the last case reported until 20 days, no case reported. Until then, every day analysis need to be done. Detection. Now, doctor, comes the story of vaccines. Remember, PSM subject may, out of 20 MCQs asked in the NEETPG tomorrow, if one question, sometimes 2 to 3 questions, if they don't come from vaccines, because vaccines are a common topic for pediatrics, general medicine, PSM, microbiology, for so many things. So if you don't read vaccine, you know every point in vaccine, you're a right candidate for the PG entrance, right? So anyway, मेरे साथ चलो 60,000 points को अपने कब्जे में ले लो, सीट नहीं आए तो मेरा जिम्मेदारी, right? So Louis Pasteur साहब को सलाम करो. Louis Pasteur is the one who has 1 minute. Louis Pasteur is the one who coined the term vaccine. Vaccination. Vaccine को nation बनाया. कौन? एडवर्ड जन्नर साहब को सलाम बोलो. Term vaccination was coined by Edward Jenner. First vaccine was developed for smallpox in 1798. उसके बाद कितना साल बीत गया? 100 years. 100 years is 1900. Another 100 years, 2000. And अभी 21st century में आ गया है. 220 years ago, first vaccine was developed. And today we are still talking about corona, right? First vaccine was developed by Edward Jenner. So please don't confuse this very Louis Pasteur vaccine term बनाया, मगर Jenner साहब ने nation बनाया उसको, vaccination. And first vaccine was developed by Edward Jenner. So how do you prepare live attenuated vaccines is a very important question. You'll pass the organism in the tissue culture or chick embryo. You pass them repeated passage through tissue culture or chick embryo. So what do you mean by attenuation? Attenuation means you will decrease virulence, decrease pathogenicity, but maintain antigenicity, immunogenicity, its ability to invoke the antibodies in your own body. You will do that. But it is not virulent, it is not pathogenic like the original wild strain of organism. Then what is killed vaccine? You kill organism by heat, chemicals, right? And then introduce that into the body so that you are stimulating a active immunity. That is by generating immune response, antibodies, immunoglobulin production. That's called killed vaccine. A lot of people have a confusion. I will tell you what is confusion. There is active immunity. There is a passive immunity. There is a live vaccine. There is a killed vaccine. Many people think live vaccine means active immunity, killed vaccine means passive immunity. No. Remember, whether it is a live vaccine or a killed vaccine, both of them are stimulating the immunoglobulin production in your body and creating a immunological memory. When you are able to do that, when you create a immunological memory, then that is called active immunity. Whether that happens to live vaccine or killed vaccine doesn't matter. Passive immunity means what? Mother has already antibodies. She transmitted it to the fetus so that the newborn is immune from developing measles. That is passive. That means the maternal antibodies are not creating any immunological memory in the newborn. Right? Unless the newborn is vaccinated with a active or with a live or a killed vaccine, or exposed to an organism, then only he'll develop immunological memory. Simply giving antibodies does not. Similarly, whenever rabies is there, some dog bites, you are giving rabies serum. In serum, you are giving immunoglobulin. That is a passive immunity. Right? But rabies vaccine, when you give, no? Rabies vaccine you give according to a regime. There it is active immunity. So what you get through vaccines, whether live or killed, is active immunity with immunological memory. Whereas what you get by immunoglobulins, either through serum or from maternal to fetus, that is all passive immunity. Okay? Clear? Very good. Next, if you look at the killed vaccines, they are safe compared to live vaccines. Suppose if you give a live attenuated vaccine, it is attenuated, you weakened, but the organism didn't die. So if the person's immune system is very weak, like an elderly cancer patient, then this live attenuated vaccine can cause some vaccine associated complications. So compared to that risk, you don't have with killed vaccine. So killed vaccines are safe, but less efficacious compared to live vaccine is what you need to remember. So how do you give killed vaccine? Intramuscular, subcutaneous, intramuscular, subcutaneous is the route by which you give the killed vaccine is what you need to remember. Then what is a toxoid? Toxoid is a toxin which is produced by the organism, which is detoxicated and used to prepare a vaccine, like tetanus toxoid. TT injection we give, no? So you are taking the toxin produced by the tetanus and removing the toxic property of that protein, tetanus toxin protein, and using it for preparing vaccine to stimulate the immune response. They are toxoids. All right? So now quickly give example. This is another Battimar Nebala item. Agaya, right? So what is the point you need to remember? Very clear. So when you go for the exam, doctor, whether it is university exam or any exam, whenever you go, no, you need to have a clarity, absolute clarity. What are examples of live attenuated vaccines? BCG, OPV. So remember, OPV strain is Sabin, right? And IPV is Salk. You remember, Salk is K. K is killed. Right? OPV, oral polio vaccine, obviously is Sabin. Sabin is oral polio vaccine. Measles live attenuated. Mumps live attenuated. Rubella, MMR. Yellow fever vaccine is live attenuated. Typhoid is live attenuated. Live plague vaccine. Then you have a live attenuated influenza vaccine, live. Varicella vaccine, epidemic typhus vaccine. Don't forget, doctor. Multiple choice question exam में examiner एक killed vaccine introduce करके जरूर आपको quiz करेगा कल के exam में, right? Then what are killed inactivated vaccines? Pertussis vaccine, Salk vaccine, rabies vaccine, cholera vaccine, meningococcal hepatitis B, Then VI vaccine of typhoid, killed plague, killed influenza, Japanese encephalitis, Kaisner forest disease, they're all killed, inactivated by vaccines. You have to be 100%. After coming out of example, oh my God, like an Einstein, I was thinking pertussis is live or killed. No, Einsteins cannot clear the entrance exam. Einsteins will miserably fail. Spinal cord level, answer should come. Your cauda equina should tell, exam hall, oh, pertussis, killed. Oh, OPV, live. Like that. Be very sure, right? हाँ. So, बट्टी मारने वाला item है tick मारना. Toxoid. Diphtheria toxoid. Tetanus toxoid is a toxoid. That's what you need to remember. Now, a part of the cell, like pneumococcal vaccine, is the capsular polysaccharide is taken as a antigen to stimulate your antibody response. So it's a subunit. Hepatitis B also is a subunit vaccine. Haemophilus influenza B, subunit. Meningococcal vaccine, they're all cellular fractions. That's what you need to remember. Then sometimes we use combination like DPT, DT, MMR, TAB, DPTP, etc., etc. Now, doctor comes purely बड्डी मारने वाला item. Quiz. कौन बनेगा करोड़ PGपति? BCG. What is the strain? Danish 1331 strain, which is WHO recommended. OPV, IPV. We use P1, P2, P1, P2, P3. It can be monovalent or it can be trivalent. OPV, IPV. Measles, Edmonston Jagreb strain, most commonly used. You also have Schwartz strain, Moraton strain. Mumps vaccine, Geril Lin strain is what you need to remember. Rubella, RA27/3. Yellow fever, 17D is what you have to remember. Varicella, OKA is varicella. Once more, doctor, these are all batti marne wala items. Nothing, no intelligence. Kuch bhi nahi chahiye. So 60,000 points I am going to give. At least you will have 20,000 batti items. Lists to remember. Okay? Don't worry, I'll give you in 2,500 pages notes this entire 60,000 points to you. Right? Now, Japanese encephalitis virus vaccine. Nakayama, Beijing P3, SCA 1414-2. Out of this, SCA 1414-2 is used in India. Again, it's Japanese encephalitis. All right? Now, swine flu vaccine is a killed vaccine. It is A7 California 2009 strains, which are the ones which are used in swine flu. This is a very important question, doctor. In fact, in my MD exam, one of the question was write about malaria vaccine. MD General Medicine. Only thing I remember is teaching students about malaria vaccine in those days. Whatever I remembered, I wrote in the exam hall in MD, right? So, SPF66 strain is malaria vaccine. It is also called Lytic cocktail strain. PF25 strain is also malaria vaccine. Now, HIV vaccines, you should remember. MVA, modified vaccinia Ankara strain. RAV, recombinant adeno-associated viral vaccine. Then CTL, cytotoxic T lymphocytic strain. And AIDS vax, subunit vaccine strain. These are all used for as HIV vaccines. Very important MCQ, doctor. Sure shot tomorrow exam. What vaccines are contraindicated in pregnancy? All live vaccines. So, can you please check whether the voice is loud and clear? Yeah. All live vaccines, except the yellow fever vaccine, are contraindicated in pregnancy. You can give yellow fever vaccine even though it is a live attenuated, but all other live attenuated vaccines contraindicated in pregnancy. Please don't forget, doctor, for the tomorrow's exam. Can the online students can punch whether the voice is loud and clear? Now, what vaccines contraindicated in asymptomatic HIV? So last month only he went to a commercial sex worker, now found to have HIV. He's still asymptomatic. Still he can receive all vaccines. None of them are contraindicated in asymptomatic HIV is what you need to remember. Symptomatic HIV, all live vaccines are contraindicated except BCG is what you need to basically remember. Except BCG. Then what vaccines are contraindicated in immunosuppressed people? All the live vaccines, without exception, are contraindicated in immunosuppression. For example, somebody is receiving steroid therapy or received transplant, right? So all live vaccines are contraindicated in immunocompromised. Somebody on chemotherapy, contraindicated. So vaccines contraindicated in steroid therapy patients is all live vaccines is what you need to remember. Whenever there is fever, what vaccines are contraindicated in fever? Typhoid vaccine, that is Typhoral and Typhim, that is stab vaccine. They are contraindicated when the patient is having an active fever. Somebody has diarrhea or respiratory tract infection acutely. Do you think any vaccine contraindicated? No. You can give anything. No contraindication. Together, which vaccines you should not give? Yellow fever vaccine and cholera vaccine. You don't give together. Once more, a batti marne wala item, doctor. Be very sure. So, hum kya karte hain regularly? We sit in the reading room. From the park, we will keep writing in the book. From the park, we will keep writing in the book, and a lot of time waste. I'm giving all points. You don't miss even one single. Tomorrow's examiner is going to ask from the 60,000 points only. Right? So it's very easy to prepare. You don't need any special preparation. Just Dr. Murali Bharadwaz, east or west. Dr. Murali Bharadwaz is the best. Please don't forget about it. And thanks for coming to class. So which vaccine contraindicated in preterm, premature baby with a birth weight less than 2 kg, 1.7 kg, 1.8 kg? Hepatitis B is contraindicated in preterm, premature baby is what you need to remember. Which vaccine is contraindicated in less than 1 year infant? Yellow fever vaccine, meningococcal vaccine, pneumococcal vaccine in less than 1 year infant is what you need to remember. Which vaccine is contraindicated in age less than 2 years? Weight less than 2 kgs, you know. Age less than 2 years. Meningococcal vaccine, pneumococcal vaccine, typhoid vaccine. Then vaccine which is still contraindicated in age more than 2 years, standalone, is pertussis vaccine. It can lead to neurological complication. Still, it is given till 5 to 6 years in India. Otherwise, a child crossed 2 years means if you give pertussis vaccine, there's a chance of neurological complication. But in India, even if the child is 4 years, 3 years, up to 5 to 6 years also, still we give the pertussis vaccine is what you need to remember. Right, doctor? Yeah. Can you please check whether the voice is loud and clear? Now, which vaccine is contraindicated if there is a progressive neurological disorder? Be very sure. If you take cerebral palsy is a non-progressive neurological disorder. Understand? So, progressive neurological disorder, if it is there, then purchases vaccine is contraindicated. That is the reason if patient has epilepsy, but it is controlled by medication, right? That means it is not progressive neurological disorder. Cerebral palsy, they are not progressive neurological disorders. So their purchases is not contraindicated. Definitely a Pucheka examiner. Purchases vaccine, when will the neurological complication become an issue if you give it at the age more than 2 years? But in India, we still give up to 5 to 6 years. Third point, only progressive neurological disorder is the contraindication. That's the reason cerebral palsy and epilepsy controlled by medication is not a contraindication. That's what you need to remember. And the only absolute contraindication to killed vaccine. Live attenuated vaccines, pregnancy, you have to be careful. Immunocompromised, you have to be careful. So many things. Killed vaccines, generally no contraindication, but the only absolute contraindication is previous dose. If there is a local or a general reaction, then that is an absolute contraindication, is what you need to remember. Now, few important vaccines and their complications. Guillain-Barré syndrome. What is Guillain-Barré syndrome? Post-infectious demyelinating polyneuritis is called Guillain-Barré. Infection के बाद demyelination के साथ multiple neurons are involved. Polyneuritis is Guillain-Barré. So Guillain-Barré can be complication of a killed influenza vaccine, is what you need to remember. Then VAP. What is meant by VAP? Vaccine associated paralysis is VAP. VAP is a complication of OPV, is what you need to remember. That's the advantage of IPV. With the Salk vaccine, VAP is not a problem. Right? Next, toxic shock syndrome, measles and MMR. Toxic shock syndrome is a complication. Shock can occur, DPT and pertussis vaccine. Hypersensitivity is a complication. Whenever hepatitis B, meningococcal vaccine, DPT, DT, anything can lead to hypersensitivity. Then, can you give 2 live vaccines together? Yes, sir. You can give 2 live vaccines together. BCG, live attenuated. OPV, live attenuated. Are you not giving them together? We are. 2 live vaccines can be given together. Live and killed vaccine can be given together. These are all individual options in an MCQ. Examiner is going to ask you. Okay, doctor. So, next. Cholera vaccine, yellow fever vaccine, you cannot give together. OPV, generally, live vaccines, killed vaccines, what is the main difference? You have to give multiple doses of killed vaccine. For killed vaccine. Live vaccine, only 1 dose is enough. BCG, for example. How many BCGs you will take? Only 1. You will take multiple BCG. Check. OPV is the live vaccine, only live vaccine. OPV, only 1 BCG, not multiple BCGs. Right? So, OPV. So you should remember OPV is a live vaccine where single dose is not sufficient. All other live vaccines are given in single dose. That is what you need to basically remember. So, doctor, we finished almost 130 points in 1 hour, 10 minutes, right? So, every day, let us study together for a couple of hours. We'll increase the number of hours every day. In 2 hours, my goal is 200 points. And 300 days, I finish 60,000 points, right? 300 days is how many? Almost 9 to 10 months, right? But still, you need to sail with me. After that, all this becomes a video available in the app. Until then, we need to sail together, right? So thank you very much for joining the wonderful evening.